Hello, welcome to everyone to today's webinar on courageous leadership, enabling safer healthcare environments. My name is Denise McQuaig, and I'm the Executive Director of Healthcare Transformation and Capacity Building at HEC. As we kick off this session, we'd like to share that we're pleased to offer French simultaneous interpretation provided by Boost Events, a subsidiary of Boost Lingo. If you wish to hear the voice of the interpreter, please select French from the interpretation menu at the bottom of your screen. If you do not see the interpretation menu on your screen, please select the icon with the three dots in the circle. It will be on the toolbar at the bottom of your screen, the More menu, and select Interpretation. We also invite you to please access the View Options menu at the top of the slides to select in which language you wish to see today's slides. If you're using a newer version of Zoom, you can choose the slides you wish to view by selecting the appropriate tab from the top of your Zoom screen. I would like to start today by acknowledging that we are meeting on the land that has been inhabited by Indigenous peoples since the beginning. In particular, we acknowledge that we are broadcasting this webinar from Ottawa, which is the traditional and unceded territory of the Algonquin Nation. We recognize and deeply appreciate their historic connection to this place and the opportunity to gather here today. Please take the time to introduce yourself in the chat, and please reflect upon the lands from where you are joining from. If you're unsure, you can look to nativeland.ca for guidance. If you need technical support at any time during this webinar, you can reach out to one of our producers using your chat feature, and we will be posting links to some mental health resources if you feel the need for additional support during or after this webinar. It's my great honor today to introduce and take a moment to share with you my co-host, Dr. Ross Baker, who will be facilitating the discussion with our leaders today. Ross was one of the advisors on our Rethinking Patient Safety. He's an international patient safety expert and professor emeritus at the Institute of Health Policy, Management and Evaluation in the University of Toronto. Ross's research has included studies of patient safety, quality improvement, patient engagement, and integrated care systems. With Dr. Peter Norton, Ross led the Canadian Adverse Events Study, which initiated a broad range of patient safety programs and activities across the country. Ross's co-authored book on high-performing healthcare systems, published in 2008, has been widely cited. His current projects include an assessment of the impact of hospital characteristics, including safety culture, on the incidence of adverse events in hospitals, and studies of patient engagement in Canadian healthcare organizations. Although Canadian Patient Safety Week 2024 is now behind us, patient safety in all health sectors is year-round. So we're delighted to engage with you today to talk about courageous leadership, enabling safer healthcare environments. To begin today's discussion, I want to take a moment to introduce you to Rethinking Patient Safety. If you are not already familiar with the document, I encourage you to take a moment to read it. The link to the document is available in the chat box. Rethinking Patient Safety was released last year by Healthcare Excellence Canada as part of our CPSW 2023. It was developed because despite 20 years of effort to improve patient safety, we haven't been as successful as we had hoped. At HEC, we're encouraging everyone to rethink how they have been defining and approaching patient safety improvement work, and that includes senior leaders and board members. At HEC, we recognize that senior leaders and board members are key champions for rethinking patient safety. Ross, as a key thought leader in leading for patient safety, as a past board member of a healthcare delivery organization, and as one of our expert advisors for rethinking patient safety, I'm wondering if you can help start off the dialogue today by sharing your perspective on leaders' role in advancing patient safety and what courageous leadership looks like with respect to actioning rethinking patient safety.
Thanks very much, Denise, and it's a privilege and pleasure for me to be part of this conversation today. I want to thank you for inviting me and to work with these leaders who have joined us today to talk about their experience. I think this is a very challenging time in our healthcare system. We know there are a lot of pressures, financial pressures, human resource pressures, and continuing safety and quality of care pressures. And I have particularly uh, been active and speaking out for the importance of pairing safety with all the other issues that we see as important in the system. So we can't look at human resource issues alone as a matter of hiring individuals into our system. We have to look at this with a safety and quality lens as well. Are we getting the kind of staff that are able to fully function in our system right now? And if not, how do we support them so that they can be more valuable members and create safer and care environments for the clients and patients that they're looking after? So this is a real challenge in our system, and I think HEC and others have really done a good job of continuing this focus, making sure that we see safety as a critical priority for our system, and that we reach down through the organizations and across organizations to ensure that people have the tools, the capability to ensure that they're able to provide safer care moving forward. So thanks very much for initiating this conversation. I look forward to the dialogue that we'll have with our participants today and with our speakers on these issues.
Thanks, Ross. To support leaders on their journey towards implementing rethinking patient safety, we've developed an activity designed to encourage self-reflection and discussion among leaders across all sectors of healthcare. The activity involves exploring all 5 domains of the measurement and monitoring of safety framework: past harm, reliability, sensitivity to operations, anticipation and preparedness, and integration and learning. Using safety clouds, each safety cloud contains 2 themes, each highlighting a common challenge that healthcare organizations may encounter as they move towards rethinking patient safety. With the activity, the themes are presented by sharing a brief background and then asking a question that is intended to spark reflection and discussion. The intent with this activity is to break it down into bite-sized chunks. It is much too dense to do it all in one sitting. This idea is that over several months, each of the safety themes can be discussed. It is hoped that the activity and the questions posed will help leaders and board members advance the maturity of the safety conversations occurring at their meetings. To introduce this activity to you, we've invited Dr. Baker to facilitate one of the safety-themed conversations with our panelists in real time, and we will start by introducing each panelist. Then I'll turn things over to Ross to start the facilitated safety conversation with our courageous leaders today. So joining us, we will have Dr. Katherine Chubbs, President and CEO of the Good Samaritan Society, Angela Morin, Patient Partner, Lead Patient and Family-Centered Care at Kingston Health Sciences Center, and Kelli O'Brien, Vice President of Quality and Health Learning Systems in Newfoundland Labrador Health Services. I'll turn things over to you, Ross.
Thanks so much, Denise, for starting this conversation. And I just want to say a few words about the measuring and monitoring of safety framework, which has been a critical new way to think about safety. And hats off to Healthcare Excellence Canada, and before that, CPSI, in terms of using this framework, seeing and using this framework in a lot of the work that we've been doing across the country around thinking about and improving our focus on safety. This work is now more than a decade old, and it was done by Charles Vincent, the English patient safety expert, along with Jane Carthy and Susan Burnett, his colleagues in London, with funding from the Health Foundation to develop this tool and this source. Canada has been among the leaders in using this framework and integrating this into safety work. And I'd like to give a shout out to Anne McLaren, who's been doing uh, noble and important work in terms of taking this framework and moving forward and working with teams across the country to help put this into place. Let's move on to the next slide. So we're going to focus on, as Denise says, only one of the elements of the measurement and monitoring framework, and this is the element of sensitivity to operations, which really poses the question for teams and for leaders: is care safe today? And the critical aspect of this dimension is that it really calls out the role of the team in understanding, being sensitive to changes that happen to patients, and sensitive to activities that happen at a team level in the organization, because the front line is the critical area in which we need to strengthen in order to ensure that we have safe care moving forward. And it becomes a focus now for building teamwork, creating greater psychological safety, and creating a just culture so that team members see this responsibility to really focus on safety and to ensure that the care that's being offered is safe today, and then moving forward will be safe tonight, tomorrow, and in the immediate future moving forward. Next slide, please. So sensitivity operations at a team level asks the questions about observing, listening, and perceiving. And we ask team members to be thinking about this in terms of the patients they're looking after, but also being sensitive to the broader group of patients. So if you have a new team member who's come in who hasn't worked with the team before or hasn't worked in this unit before, you really need to be asking the question: how can we help them to observe, listen, and perceive? So it's building teamwork, it's building an observational listening skills in order to understand whether or not the care that we're provided is safe. Next slide, please. And as I mentioned earlier, I think that this is an issue largely for individuals and teams, but it's enabled by the work of leaders throughout the organizations, both at a team level and at an organizational level, and sometimes between organizations as well, so that those leaders can be alert to the needs of their teams and the potential issues for staffing, staff health, well-being, equipment availability, increases in demand, and a host of other potential problems that we're seeing in many organizations across the country right now. So leaders enable staff to be more effective in their daily work, and they need to be sensitive and understand what's happening on an ongoing day-to-day basis within their organization. Next slide, please. So how do we do this? Again, we need to do this at several levels. We need to do this at the team level in terms of the behaviors of staff, being sensitive to what's happening for their patients and for their units, to doing safety walk rounds, and leaders as well as staff can do this, to create operational meetings and structured handovers and rounds so we have this continuity of care moving forward. And then briefings and debriefings, conversations with staff and with patients about what's happening on a daily basis for individual patients and across units in the organization. And then patient interviews to get a sense of what the issues are for them, and safety huddles. So many things that need to be integrated into daily work. And of course, in the current environment, this becomes more important, but also more challenging to do. And we have to ask the question: what can leaders do to ensure that these activities happen on an ongoing basis? Next slide, please. The second theme that we talk about in sensitivity to operations is not only understanding is care safe today, but today asking the question, what can leaders do to capture insights into work is done? And the challenge for leaders, of course, is they have many roles. They have roles at a system level, they have roles at an organizational level, and they have roles in terms of ensuring that their staff are capable of providing safe, effective, patient-centered care moving forward. And in doing that, they have to understand what's happening at the front lines. And this is, again, very challenging, particularly in large organizations where you have unit leaders, and then you have middle managers, and then you have senior leaders who have to work together to have a shared understanding of what the priorities are and what the safety challenges are moving forward. So as we think about this, we have to ask, what can leaders do to improve their vision, to improve their understanding and their capabilities to build effective frontline teams? What else can they do to learn from, to see, hear, and perceive what the soft intelligence is on the units, not just the metrics that are moving forward? Next slide, please. So Safety Cloud Theme 5, the background is now moving our shift from work as imagined, work as we think the policies are telling us what happens, to an understanding of what happens for staff on a daily basis on the front line. By work is done, we mean what is the critical issues, hour by hour, shift by shift, that the soft intelligence that's gathered by staff about their patients, about their work, and the potential safety risks that are involved in that. So what we hear, see, and perceive as experienced staff and as teams on the front line is just as important as the ongoing metrics that are being collected and informing the organization. Next slide, please. So setting up our conversation with our three leaders today, we want to ask them to reflect on how, as leaders, they get insights into work is done within their organizations and what they can do to help orient their teams, help to support their teams to tune in to this listening, observing, and perceiving as a method for understanding how to create safer care. Next slide, please. So I'm going to start by turning to our leaders and asking them the question. So how do they really reflect on these challenges moving forward in their organizations with all the pressures they see on a daily basis to ensure that they're creating these effective frontline teams that are working well as teams, that are using psychological safety and just culture principles to create a greater understanding of what's happening at the front line. So, Katherine, I'd like to start with you. And in this large, sizable organization that you lead in Western Canada, providing care to a large number of patients in many different settings, can you tell us how you reflect and share this challenge and how you address it on moving forward to really build a better understanding beyond the metrics that are reported to you so that you can help your teams learn, observe, and tune into the care delivered at point of care to create a safer care environment?
Thank you, Ross, and thank you for the land acknowledgement. Maybe I'll start off by saying every role is different. So obviously in my role as president and CEO, it looks a little bit different than if I was a frontline leader, but there's a huge role for me to play. And I'll also say that, it's really, really hard. When you're addressing safety, you're tackling big issues like significant workforce challenges, including leadership, significant challenges to psychological safety. It's not just about physical safety. It's not just about removing hazards. It's also about changing culture and making places welcoming for everyone. So, the work that I do encompasses a lot of the different things. Maybe on that more system level process, really creating structures within the organization to hear the voices of our employees. As an example, we have a reconciliation advisory group, so an Indigenous advisory group, and we pull them together. I sit on the group, I don't lead it, and we honestly share our experiences as Indigenous people working in the organization, and we're forming a similar group for equity, diversity, and inclusion. And so making sure that we're able to hear the voice of our employees in in a more systems focus, and in taking those learnings and what we hear about their experiencing and turning it into actions and turning it into policy directions. Getting out to the sites, I think that's the number one way. I spend a lot of my time on the road. We have 61 sites, and I spend a lot of time going out to the homes, directly observing our staff, looking at our environment, really seeing our eyes through the lens of a leader, but also through the lens of someone who might live in that home and work in that home. I take a lot of time to speak with managers and our frontline employees on their experience. Just a couple of days ago, I went to a home and sat down with all the staff that were working, and we talked about their safety concerns. So really having open and shared dialogue around what safety challenges is in their environment, and hearing their advice on how to solve those problems, because they're closest to the front line. Their advice is probably the most valuable that we can have. As I mentioned, creating structures to hear from our employees, but also creating structures to hear from residents and families. So in addition to going out and speaking to our employees and our leaders, I also speak to residents and their families, especially residents, because that's who's there most of the time. And just to get a sense on, what their living experience is like. And it's really interesting that a lot of residents will be very open about anything that they see as concerns for staff safety. So not only just a concern around their safety, but around staff safety. So trying to take safety conversation and make it holistic in those visits. And the other thing, I guess, is just creating a safe space for employees outside of the workplace where they can share and feel safe to share honestly about safety. We recently hosted a wellness conference, and during that day, we had a huge cohort of our employees, but also employees from other organizations come and speak in a panel forums over the course of the day about different safety topics, and being able to really encourage them to speak their truth and to share their experience. Over the course of the last 15 years or so, I've done a lot of what I call safety walkabouts. I've called it different things depending on the organization. It could be a walk to talk or safety walkabouts, where I actually go around and huddle with employees at the front line to talk about safety concerns. And I always take it as two baskets. One is employee safety and one is resident or client safety and patient safety. And they give some great ideas and kind of commit to being able to take their concerns away and work in the background to help support them solve some of the challenges that they have. Recognizing my position of influence and power that comes through my role, and being able to use that for good, translating to the front line. And then the other thing that I do is, I'll share videos and correspondence with our employees in writing, in addition to the face-to-face, just constantly reminding them about safety and what they can do to help address their own safety, and trying to empower them to be proactive with managing safety concerns, whether it's psychological safety concerns or even mental health concerns, some physical wellness concerns. So really trying to role model and send a signal that safety is a safe topic, and it's okay to address your safety concerns. We want to know. I say to our employees, and broadcast it to the organization that we need to hear their safety concerns. I know you talked about the data and metrics, but that's another key source for us. We have a very strong culture of reporting here at Good Samaritan, and encourage our employees to report any safety concerns they have. We look at it on an individual basis, but we also look at it in the aggregate, so we can have high-level policies, but also make sure that we're addressing those individualized concerns that come through that as well. And then, of course, we take that big data sets and try to look at how do we address things systematically as an organization. So a lot of different things that we're doing. I'm sure I have lots to learn, and I'm looking forward to hearing from other leaders about their methods today. But these are some ideas and some things that I do on a regular basis.
So your role as a leader is really an important one in terms of providing communication across the organization as a whole, across the various care homes that you're working with, the programs that you're working with. Can you say a little bit about what kinds of issues have really emerged in the last few years that you really have to address in order to ensure safety across the environments that you're responsible for?
Yeah, I think two are more pervasive than others, perhaps. I think one is the safety issues associated with workload, whether it's at the leader level and just being able to manage all the different things that's coming in. Because there has been, since COVID, there's been a higher than normal transition in leadership. So the learning curve is stronger.
Right.
And then I think from a frontline perspective, just the risk of having to work with less staff, new staff, agency staff, those types of things, it makes it more challenging. So there's definitely safety things that we watch out for in those settings that just makes us hypersensitive to the increased risk. And then I think the other one that, is front and center in Good Samaritan and our strategic priorities is around inclusion. It is one of our strategic priorities, and making sure that when any Good Samaritan comes to work here, or when any partner or stakeholder interacts with our organization, they feel a sense of being and belonging. They feel a sense of welcomeness, and they know that under our roofs, they won't be judged. And so really trying to create that psychological safety. And it's a work in progress. So we have, our employees are a subset of the population, and there's work to be done. But those are two that, I've certainly been involved with addressing in my time here, and no doubt we'll continue to have a front row seat with that going forward.
Yes. And one of the issues that many people have talked about is the link between staff safety and resident or patient safety. Can you say a little bit about how you help to reinforce that connection so that that staff and leaders feel that their health and their well-being is as important to the organization?
Yeah, so we have established and are vigilant with making sure that the voice of our residents and families are heard at various levels within the organization, whether it's from frontline and in the huddles that our employees do, to the rounding, to the quality councils at a site level, right up to our board, where residents and families come to our board meetings and share their stories. So making sure that we're hearing what their safety concerns are. Obviously, no different than any other continuing care organization, we have top safety concerns like falls, like medication errors and those types of things. So continuously monitoring our information, being transparent with the findings that we have, and sharing with our residents and families about what we're doing with their safety concerns. And like sometimes they're specific to certain sites, but generally they tend to be the same across the organization. So again, putting actions in place and working with residents and families on solutions is a big part of our approach.
Great. Thank you so much. So I want to move on to our second speaker today, and that's Kelli O'Brien. And Kelli has a lead now across Newfoundland for quality and safety. And Kelli, I want to say a little bit about the challenges that you're facing in this newly structured organization that really covers a large geography and very, very variable circumstances and resources. So how do you create a safety strategy in that kind of environment moving forward? Kelli, can you hear me?
Are you able to hear me?
Yes, that's great. Or maybe not. So, okay, while we work on your audio, let's move to Angela Morin, who's had this role at Kingston Health Science Center across a number of different organizations providing care, and who has really taken the patient engagement, patient-centered care portfolio on as somebody who's been a patient partner, who's been a patient in the organization, and now has responsibilities across these different environments to make a difference, engaging patients around creating safer care. So, Angela, over to you. What are the challenges that you face, and what do you see as the path forward in order to reflect on this issue about engaging patients and families in the care environment to create a safer environment?
Yeah, thanks so much for the invitation to join the conversation today. Very much appreciated, and thank you for the land acknowledgement earlier. I come to this very much from how are we hearing from patients and families, and understand that that's not the only perspective, but it's a critical perspective in us moving forward. And I often see a lot of synergy between what matters and what are priorities for staff and what are actually priorities for patients and families. They're not necessarily very divergent. And so it's my job as lead for patient family centered care at KHSC to ensure that we are hearing the perspective and hearing about the experiences of the individuals that we're serving, the patients and the families that come to us for care, and to support those people in sharing their perspectives and their experiences in different ways throughout the organization. But it's not enough to just listen. We really, for us to have truly courageous leaders, whether they're patient leaders or organizational leaders, we need to be listening, learning, and acting. We need to be partnering, and we need to be collaborating and co-designing things to really hone in on what are priorities for patients and families to help keep them safe. At KHSC, similarly to what we just heard from Katherine and what I know is happening in many organizations, we hear different voices through different mechanisms. So we are hearing about their experiences using patient experience surveys in different programs or organizationally. We may have focus groups on specific topics. We are listening to our frontline staff who often share and relay information from patients and families. We get a lot of information from volunteers who are often really close to patients and families, especially people who are coming in on an ongoing basis into our ambulatory care settings, and they really build relationships. Our patient relations folks are able to provide lots of feedback and quality information and data for us from people who have reached out to patient relations to deal with specific concerns. And things like social media and just community input all give us that patient perspective. But one of the things that we have done very intentionally is and to create the opportunities to listen and learn is to be partnering with patient experience advisors who are all individuals who have had an experience or are currently having an experience in our organization receiving care in some way. And so these patient experience advisors are providing input and feedback and guidance at every level of our organization in various ways. They bring their perspective to our patient education resources to ensure that the things that actually matter to patients and the information that they need and the questions that they have are being addressed. They participate on working groups and committees and projects and research. We have 3 patient and family advisory councils. We have a 4th one in mental health and addictions being developed right now. Our KHSC PFAC meets monthly with usually summers off if we can swing it. And the executive sponsor, who's Dr. Mike Fitzpatrick, is our chief of staff and our executive vice president of medical affairs, who comes to the meetings. He shares organizational updates, answers the members' questions, and listens to concerns and priorities that they have identified. In addition to that, we have patient safety and experience reports being shared with the PFAC on a quarterly basis. Our Director of Patient Safety, Quality, and Risk is a member of our PFAC, as well as our professional practice lead. And so they have opportunity to hear directly from the members on various issues and topics that staff are bringing to the PFAC for input that are priorities for the PFAC members, including things like quality improvement planning and meeting accreditation standards. The Patient Safety, Quality, and Risk Executive Committee, the Patient Care and Quality Board Committee, the Oncology Patient Safety Committee, all have patient advisor representation on them. We look to share patient experience stories throughout the organization in different ways for different purposes, including at the program level for quality improvement, as well as for learning and education and knowledge exchanging. We have patient stories at our patient care and quality committee of the board. And it's been a lot of years of working on the processes around that to ensure that it is a safe and meaningful endeavor, that we are sharing these experiences in a way that is really purposeful for both the person sharing their experience as well as for the people learning from it and hearing it. At the board committee level, it's been a really interesting evolution. We've been doing it for a few years now, and it's taken a lot of conversations and sort of parsing out how this is different from getting into the weeds at a quality improvement level at the front line, and really thinking about what is a governance role and what does hearing a patient story mean? What can I do with that? So it's not just I just heard it and that's all there is to it. So and what we've really honed in on is understanding what is your role as a member of a governance committee, and really having to think about what do these stories mean to you. And what we've heard from the patients and families that have shared their stories at that level is they feel as though it's a very valuable thing to be doing. They appreciate the feedback that they get back from the committee about the input. They appreciate that the information gets shared not just to that committee, but then is filtered down into our program level committees. And at the board committee level, the members of the board committee have been really engaged in making this work and understanding the importance of it. And just recently, I had a message, and I'm going to quote here because I thought it was just so great, because they said they felt that they were of the utmost importance. And aside from informing our work as a committee, we are bearing witness to the day-to-day occurrences in our organization. Patients are our core business, and if we are not listening, then perhaps we are missing the key point in our roles and responsibilities as governance. And so I really think that having that understanding of the purpose of hearing about patient experiences at different levels and understanding what can be shared at those levels to be impactful has been a really big piece of work for us that we take very seriously and hold as a great responsibility. Because we've also heard from patients and families that it is really vulnerable to raise your voice about safety. It is a very vulnerable place to be. There is a huge power imbalance. I recently shared a patient story at a board committee meeting from a very experienced patient advisor who has an ongoing relationship with our organization. And she said it was so frightening to think about challenging or questioning this particular program because she's so dependent on that care. And there are no options. There's no other specialists that she could go to. So to actually come forward and say something doesn't feel right or isn't working well is really challenging from a patient perspective. And I think we need to recognize that that is a concern and create opportunities for them to safely be sharing and know that it's safe for them to share their concerns about safety. We have a few examples of impacts of learning from patient experiences and perspectives for many years of doing this, but it includes like things as simple as, well, not simple, actually it took a while, but creating an information services guide position to ensure that patients and families are supported and greeted at the front doors alongside with the volunteers, that was important and a priority for patients, and we made that happen. The implementation of patient-oriented discharge summaries, development of care pathways, care closer to home clinics and supports, changes to various policies and procedures, co-designing patient resources like our It's Great to Ask tool that helps facilitate conversations at clinic appointments. And patient experience advisor rounding, where they actually capture in real time patient feedback peer-to-peer that is then shared in a huddle with staff. And it's a partnership between program management and the patient advisor. Our PFAC leads patient and family-centered care um, project grant committee, where frontline staff can submit smaller patient-centered projects that they don't really have the budget for and need some funding for. And the committee is completely made up of patients and families. They identify who gets what funding. We work in partnership with our foundation to ensure that the funding is available. And we've seen things like creating better patient-family spaces, compassionate care carts, developing resources to support safe care, all kinds of really cool projects that have come from the front line and have created a really lovely relationship between our patient advisor groups and the frontline staff who see what patients and families are struggling with every day. So to me, tuning into what's happening on the ground and providing safer care really does require understanding the experiences of really everyone in the organization, and that includes our patients and families. And we need to be doing that in meaningful ways that we can actually act on, and empowering the staff and the patients to help co-design and find solutions to care. So, I think that courageous leadership is all about being transparent, being willing to think about things in a different way, being proactive and collaborative with everybody.
Well, very impressive, Angela, and thank you for that update on what's happening in Kingston, because you have been among the leaders in this country in terms of ensuring that patients have a voice at every table. And your presence and leadership on that, I'm sure, is reinforcing the understanding that the patients have many different roles and need to be heard, and the things that they say need to be taken into consideration as the organization addresses critical issues across a wide range of services. So thank you for bringing up to date. I have a continuing interest in hearing how you're managing this wide range of activities, because that in itself is a challenge, and making sure that you have the ability to not only deal with individual issues, but you have the ability to identify safety priorities and safety challenges that have broader appeal, I think is important, but also challenging to do that individual focus at the same time that you do the broader sort of system focus. But maybe we'll come back and talk about that in a way in a few minutes, but I want to turn to Kelli. Kelli, can you hear me now?
I can. Are you able to hear me now?
Yes, great. Thanks so much.
Perfect.
So Kelli, you have a role in a newly formed system that brings together regional organizations and delivery organizations across the province, and that makes it even more challenging to get a view about how do we hear the message and support the teams at the front line so that we understand what they're hearing, listening to, and perceiving, and that you can respond in a way that's interpretable across the province. So tell us how you're approaching this challenge and what you see as the steps moving forward.
Thanks so much, Ross. We have been very deliberate in designing our organizational structure. And I think, recognizing that we are 22,000 people across this wide geography, we've been deliberate in a structure that enables both transformation, but also ensures that sensitivity to operations and safety. So we have zone structures where we have an executive responsible for operations within a zone. In addition, we have provincial programs, which would be programs that actually lend themselves to a provincial program in nature. So from a commonality, so for example, cancer care is provincial. And we also have transformation structures. And so transformation structures are really guided by our big ambitious agenda in the Health Accord, which really serves for us to guide us in terms of the change that we need to make and all the priorities for the organization. We also have been very focused on creating a strategic plan and strategy at a board level that we can cascade that reflects that Health Accord. And so our key priorities are certainly our people. So we know human resources are definitely a priority, no different than in terms of gaps and concern for our workforce. than the rest of the country. We've identified access because we know that without access does influence outcomes and it influences safety. So our goal really is, and we've been putting strategy around improving access. Additionally, it's our whole focus on transformation, really reshaping, reimagining the healthcare system from one that's reactive to one that's really focused on preventative care and addressing the social determinants of health, to really address some of the health inequities that we see. Albeit health equity is also one of our most recent strategic pillars. So, within the quality and safety portfolio, where we also have planning and performance, which we're linking our strategies to our strategic plan, we really are seeing ourselves and are responsible for creating those building blocks to create a system that supports and embeds routine improvement activities by creating that environment that fosters people, inspires people to do improvement work, and also gives them the resources to do that. So we've been quite strategic about it, both in creating structures in the organization from a board level, but also in terms of learning networks, learning quality improvement teams. We have been focused on patient safety knowledge, skills, and responsibility, trying to spread that throughout the organization. We hosted our first inaugural patient safety days during Patient Safety Week, and it was really quite, and it was, the days were co-designed with patients, because we're doing nothing without patient and family advisors in terms of these changes. So the whole days were designed, the agendas were selected in terms of the topics and the individuals presenting based on what mattered from what came forward from the front line, from volunteers. And we also awarded staff awards, the first inaugural safety awards for their work that's happening. We have been focusing on building a skill and capacity at the board, recognizing it's a brand new board, and we have a brand new board quality and safety committee. So that oversight role is so important. So we've been spending quite a bit of time there. But we've also been spending time absolutely on that frontline level and leadership level, building standard leader work, standard leader behaviors to really support the organization and to support people working within the organization. We have been embedding patient and family advisors in our networks, in our teams. They're sitting on our board quality. This is brand new, and I'm very happy to say that. We just did an expression of interest, and although we're 20 months in, we're still new. I still like to say we're toddlers. And so we've just sent an expression of interest, and we have 2 advisors who are going to participate on the board quality and safety committee. We definitely have been working on ways to optimize communication with patients, between patients and providers. So things like our digital front door, our new HIS, which is going to definitely transform the system for in terms of some of those transformative changes that have to happen. We're looking at empathy training for our teams as well. This came forward from our patient and safety advisors as a real concern. And so we started it in one location, and our intention is to spread it across. So we really are, I like to think we're building on all the good things that we had in the 5 legacy organizations and creating a new agenda as we go forward that doesn't forget about the past or the positive things and builds upon the strengths of all those. We really have been working hard around creating that environment in which staff feel safe to speak up and are empowered to intervene. And I say this because, in this time of change, and it's still changed because we're very early, there is a hesitancy for people because there's a sense of instability. So we really have been trying to create that environment of a just culture, of an openness for staff to bring forward ideas. So we've been doing just culture training with our managers. It's actually in our strategic plan, and we have to report on it. We have to be able to report on an indicator associated with having moved that throughout the organization. We're building an I Have an Ideas opportunity, which is a portal, might be email, based for staff to actually on the front line bring forward ideas that we'll be able to then have a team in process improvement, human resources, who help triage and say, that belongs in human resources, that's a quick fix, or that's not, and that's more complex, and let's pull a team. Let's invite that person who brought it forward to participate in both framing the problem, but also the solution. We really have been working hard to build awareness and communicate the value of patients and partnering for patient safety. So I already indicated at the board level, and really sharing the successes across the organization. I'm going to stop there, Ross, because there's so much work that we're doing. The other thing I could share, sorry, is that we just recently created a quality and safety scorecard. And so these are our key measures at the board, but they actually cascade. So they cascade into the zone, and then they're going to cascade into huddles, into scorecard boards, performance boards on the unit. So they won't be the same measures, and we don't anticipate them to. We expect that the programs to be building their own measurement around what's important to them, what has meaning to the work that they're doing, but we will see them roll up into our big dot measures, because we all have the same aim, which is achieving the quintuple aim. So we've been embedding the language of the quintuple aim in all our frameworks, in all our conversations about why we're doing what we're doing, is really to ensure we have better experience and outcomes, ensure that we have better value, enhance population health. So these are the conversations, and to create, ensure our workforce is healthy and engaged. So I'll stop there, though.
Wow,
I could
Kelli,
talk forever, but
thanks. It sounds like you have a expanding portfolio of activities, and I'm sure that I could pick a number of these things to focus in on. We're a little short on time, but I do want to ask you about the empathy training. What does that look like, and how has that been received?
So it's interesting, Ross, it started in one of our prior zones, before one of our prior health authorities before we became together. They received some funding, and they have put several managers and staff through empathy training, which really is about communicating with empathy. And so I think Angela referenced, when she was speaking around really listening, having that curiosity of the conversation, and really trying to place yourself to understand from a different perspective and lens. So I think there's real value in staff, because we talk about people-centered care. We've been really working hard to try to create a system centered around patients and families and their experience, but I'm not certain we've equipped staff with understanding what that means. And empathy is one of the things that we've heard, that, staff aren't sometimes respectful. Sometimes staff aren't, they don't understand. And so we know that it's through the patient voice that we create safer care, because they know themselves best. So it's really about creating that environment and dialogue, and introducing introducing the opportunity to self-reflect on empathy. So certainly happy to share in terms of the training that particular area went through as part of our people-centered care broad strategy. Yeah. And we just continued on that course in that one zone, and we don't have our lessons learned from it yet, but I'm certain once they're documented, we'll use them to inform how we scale and spread across the province.
Well, I think that's really important. I wonder whether or not the empathy applies to team members as well as to patients and families.
Oh, absolutely, Ross, absolutely, because the team environment and that safety and that understanding, how we all show up and what else is around us, I think is really important in the environment, and that sense of belonging and creating that safe space for our team to be open in their communication and to be able to bring forward issues and opportunities, but also to say, today is just not a great day for me. I just need a moment. And I think sometimes, we haven't always created those environments for people. And if we've created an environment, as you know, that's in civil sometimes, it does not help with patient safety or that team cohesiveness and that team functioning. So it's on both. It's for both, actually.
Yeah, well put. Thank you so much for sharing that. I'm going to turn it back to you, Denise, because I know our time is quickly disappearing. So want to give you a chance to sum up and ask questions.
Thanks, Ross. I am going to just pause for a minute to sort of sum up some of the things that I heard from our panelists. So I certainly heard loud and clear and consistently that our greatest challenge is likely changing culture. We heard some suggestions on how we might be able to do that. Creating specific processes for voices of our employees. We heard examples of Indigenous employees coming together. We heard examples of commitments for equity, diversity, and inclusion being created. We heard strong encouragement that as leaders, we need to get out to the sites. We actually need to be present in the front line and hearing directly from those who are delivering care. We heard consistently that patient safety is not just about the safety of those receiving the care, but is equally about the safety of those delivering the care. And some comforting words that when that has been taken into consideration, there's actually a greater synergy than we might actually anticipate between what we're hearing from patients and families and what the workforce is telling us. We heard about the importance of not just listening, but learning and acting, commitments to co-design. We heard about patient and family advisory hitting at all levels of our systems, including our boards of directors, and being able to speak to the leadership. We saw a wonderful example of a patient family advisory council where the executive sponsor is embedded in that circle, as is the director and the practice lead. We've also been monitoring the chat, and we heard clearly that there is a desire for patient advisors and volunteers to have some indemnification, to feel that they can participate with their honesty on an equal playing field to those who are paid to be present. We heard that there is some challenges and some inherent barriers to patient and family participation, and that we need to pause as leaders and think about how perhaps in our place of privilege, we're not experiencing those same barriers, but they need to be addressed. Um, and we heard about the language that we use. I can certainly attest to the fact, after over 35 years in healthcare, we have a lingo, we have a way in which we talk. We tend to focus in on medical terminology and don't always stop to pause and think about the individuals in the room. And so being mindful of how we speak is an important part, perhaps even of empathy and just culture. I will say that for those who were in the chat talking about patient engagement, um, compensation, there are some tools at HEC. We have an organizational self-assessment tool that leaders can use to look at how they are being engagement capable and inclusive. We also have a patient partner guide for recognition if you're thinking about how you would like to appropriately compensate your patient partners who are participating in helping to create your safe environment. When we here at HEC do a session such as this, when we do the recording, we go through the chat, we make sure we're trying to adjust the questions with our panelists. So Kelli will be coming out to you. There's lots of interest in your empathy training, lots of questions about how you're using indicators. And we'll make sure that we try to include that in a few weeks' time when you receive the recording in your inbox through your registration. With a few minutes left, I'd like to pause and just ask the panelists in a few words, 3 or less, ideally, what is it that makes you a courageous leader? Angela?
I think a willingness to learn.
Thanks. Katherine?
Inspiration by those who came before me and those we serve.
Kelli?
Sorry, I have to unmute 2 things to speak. For me, it's really about listening and not being afraid to not know something. It's okay to say I don't know and to work with others. It's really about understanding others' perspective. And in my role, I do get to make decisions. So courageous leadership to me is to make those decisions that reflect compassion and care.
Ross?
Yeah, I'm struck by 2 things. I think the power of sharing experience across the wide geography of this country is really powerful. And I also think what we've heard today is the linkage between these important elements in the current environment, the patient engagement, family presence issues are linked to safety, and they're also linked to team performance and ability to create and maintain high-performing teams. And those three things are often dealt with separately. I think we have to start thinking about how they fit together, right? And start to see that we can address more than isolated issues if we start to see the connections between these various challenges that we face as a system.
Thanks, Ross. And thank you to all of you. The fact that you have taken time out of your day, out of the busyness of our work, to pause, to think about rethinking patient safety, to expand your understanding that the absence of harm does not equal safe care. You are, in fact, being courageous leaders, each of you. So please take the time to help us grow by filling out the poll that you see on your screen. And please feel free to follow up with us should you need further information or support. We're so pleased with the number of individuals who have joined us for Canada Patient Safety Week. In the chat, you will have seen links to other training opportunities and ways of engaging in this important topic matter across the country. Now, thank you and merci.